What do you do if you water break? I mean, if you're watching the movies, you immediately grab the hospital bag and head on into the hospital as fast as you can because that baby is coming right out. But Hillary, nurse since 1997, 20 years in labor and delivery, is here to tell you that is not what you should be doing. So today I'm going to tell you the steps that you should be doing if you think your water has broken. I'm so glad that you guys are here because people make a lot of mistakes in this area and it can really compromise the labor that you're hoping for. And if you're like, Hillary, I have no idea what labor I'm even hoping for, grab my free birth plan series down below. It's going to get you started thinking about what you would like for your labor because this can change things very quickly. I'm even going to give you some scripts that you can use with your provider on the phone if you kind of want to change what they're asking you to do, which is totally okay. As a reminder, this video that I'm filming here today is just for people that are term. So if you are an okay place for your baby to come out right away and everything would be just fine, then this video is for you. If you are previous to that point in time, you don't take and utilize this information until you are at a safe, good place for your baby to come out. So if you're before 35 weeks or so and your water breaks, or even 36 weeks, you need to call your provider right away and see what they want you to do, or head right on into labor and delivery. Because as you're going to find out in some of our things, sometimes calling your provider can take a little bit of time. And, if you're early on, you want to head into labor and delivery right away. 2 facts you guys need to know. Number 1, only 15% of people's water breaks before the hospital. So this is not a real likely scenario, but it does happen to people. But I think that will assuage a lot of fears because I know a lot of you are like, I know what I'm going to do if my water breaks, especially if I'm in public. And if that's you, I actually have a whole video on what to do if your water breaks in public. I'm going to link that one down below for you. The other thing is about 10% already are in labor. So they're having contractions. Things are already going. So they kind of knew things were picking up at this stage in time. If you have your water break before you're having any contractions or even, contractions right after your water breaks, you would be considered PROM, premature rupture of membranes, meaning it's happening before you're in labor. And most often you're in labor. Now, if your water breaks while you're already in labor, that means that labor can pick up. It can become a little bit stronger, meaning they hurt a little bit more. They might come closer together and they might last a little bit longer. Because as you can imagine, if you're squeezing on a water balloon, oh my gosh, my baby's been shoved in the shelf. Poor little baby. Okay. As you can imagine, let's pull out this uterus. This uterus is filled with a nice big water balloon. If I'm squeezing on it, I can't squeeze on the inside of the water balloon as hard because it's full, right? Once that water balloon breaks, I can squeeze a little bit harder, which means it can be a little bit more painful. So that's important to know about your water breaking as well. And, if things pick up, it may be the time where you're like, now I know I need to go to the hospital. And I have a whole video on when you should head into the hospital. I'll link that one down below as well. Okay, let's set this baby back up. I shoved her up there because my son's girlfriend was sleeping in my filming area. Anyway, there we go. By the way, got a good name for that baby there. I love it. Tell me in the comments. And back to, things hurting more once your water breaks. If you're like, Hillary, I love tips like that. I actually have a whole ton of tips that can totally help you feel prepared for your pregnancy. I'm going to link the class that I recommend down below. Okay, step number 1, are you sure? And you're like, Hillary, how confusing can this be? And I'm here to tell you that once you get later into pregnancy, a whole lot is going on down there. There's changes in discharge. Things are just different right there. So even me, Hillary, the pregnancy nurse, even on my 3rd baby was like, is my water open? Because it's just a lot coming out down there. It's totally normal in those last few weeks of pregnancy. You have increased blood volume in that area. Baby's putting more pressure on that area as they grow and descend into the birth canal. So it can be really confusing. Now, I have a whole bunch of videos on how to know if your water is broken. I'm going to link one of those down below. But my 2 best tips are, if you're not sure, put on a pad, lay down, 10 to 15 minutes, get back up. If you don't feel a gush of fluid, then probably not your water breaking. And, you may not feel a full gush of fluid. It depends on where on the uterus your water breaks. As you can imagine, if you're standing up and your water's broken up here, you might just get a little bit of spillover, but the rest of your bag of water is fairly intact as it's pushing against the walls of your uterus, and so you don't get a ton of fluid. Versus if your water breaks down here, you get a whole gush of fluid. So it can vary depending on where on the uterus it is, how you're standing or sitting, how much water comes out. So putting on a pad, waiting for a little bit, then standing up can help. Also, coughing can a lot of times elicit a little bit of fluid. Of course, that in case it was pee, that can elicit that as well. Because baby could kick really strong and you can get a gush of fluid and it is pee, not water. Totally not unusual. None of your nurses are going to judge you if you walk in and say, I got a gush of fluid. We always check to make sure it's amniotic fluid and not something else. There is a test that we can do for that, so that's good news. But it could be pee instead of amniotic fluid. So the first step is, are you sure? Go through those steps, watch those videos. I have tons of information on it over here because I know it can be really confusing. In fact, I know a lot of pregnancy and labor, birth can be confusing, which is why I have that class, which I'm going to link to down below. Because ain't no couple got time to watch all of these videos. I make it really simple and I put all the good information just in that one class for you. Fun fact, which you may not know, amniotic fluid is actually comprised, when you're later on in pregnancy, of mostly baby pee. So we all know babies keep peeing, fluid keeps coming out. So even if your entire amniotic fluid sac drains almost entirely, if your water breaks down here, it's still going to have small gushes of fluid as baby pees in the womb. Fun, right? Everybody loves to think about that. I actually have a whole video on gross things you might feel during labor. And that's one of the things that catches a lot of people off guard, how it feels to have the fluid coming out of your birth canal and you can't stop it. It's just now and then. So fun. These are fun things, right? Okay, the next step to ask yourself, and you're gonna skip, if you get a big gush of fluid, you're mostly skipping that first step. The next question is anything else coming out? Now, I'm not saying this to scare anybody, but I think it's important that pregnant individuals know things like this. Things like the cord or a foot or an arm can come out into the vagina. Now, in some cases, those can be real emergencies, and it's going to be hard for you to know if any of those are an emergency or if it's okay. If you feel any body part of the baby, including the cord, has come out into the birth canal, you need to get your bum up in the air. So you're thinking the baby needs to be above the cervix and the pelvis, and call 911 because it can be an emergency situation. As I said, some of them not an emergency. Like if a hand just comes in there, not exactly an emergency, but we want to get you to the hospital ASAP. And if you're like Hillary, bum in the air, think, you're on all fours, but you have your head on the ground. You're resting on your forearms. So you really get the baby up in the air as much as you can. And yes, this is super, super rare. It's someone who's been in labor and delivery 20 years, has seen problems with it, maybe a couple of times. So it doesn't happen frequently, but I want you guys to know that. I think that information is valuable and everyone deserves to have it. Okay, the next thing you're going to want to do is to think about tacos. Actually, not eating tacos, the acronym TACOS. T is time. So what time did your water break? I think it can be smart to just text this to your partner or keep it on the notes app on your phone. You don't have to go to like the minute. You could go to the quarter hour. That would be completely fine. A is for amount. Did you get a big gush of fluid or was it just a little bit of fluid? C is for color. Is the fluid clear or does it have a tinge to it? Usually the tinge that we're looking for is bloody or brown/green colored. Those are things we are going to want to know. Obviously, if you get a big gush of bloody fluid, again, I would be calling 911 because that's something you want to get checked out. However, there can be little streaks of blood in the amniotic fluid and we're not as concerned about that, especially darker brown fluids. And O is for odor. Does the fluid smell like anything? I promise you, everyone's like, I don't know what the odor smells like, but we're mostly looking for a bad odor that could indicate that you might have an infection in your uterus. I promise you, if this fluid has an odor, you are going to smell it. So if you're like, doesn't smell like anything, you good to go. So those are just things to know. Your providers are going to talk to you about it as we move forward into these steps. The next step is to make sure that baby is still moving. Now, I'm a huge fan of kick counts. If you don't know how to do a kick count, I will put my kick count cheat sheet down below so that you can do them the right way, the way that has been showed to save 33% of stillbirths. Kick counts are important, but you want to make sure that baby is still moving down there. If you continue to not feel baby move or you feel like thrashing type movements that are kind of out of the ordinary for your baby, I would head on into labor and delivery because you just want to be checked that you and baby are safe. One of the best things about doing kick counts is you know what your norm is. So when something like this happens, you get the data of if it's normal or not. Hillary loves her data. I know a lot of people don't love doing kick counts, but one of my favorite things is having that data and you can bring it into labor and delivery if you need to go in. Next step, put a pad on, or depends on how much fluid is coming out. It's just going to help you feel a little bit more comfortable around the home. A lot of people love to jump into the shower again because they're like, what just happened? What fluid just came out? So jumping into the shower can be great for a quick shower, and then put a pad on or depends on. Another thing I love, well, first off, I love a waterproof mattress pad. You need to get one on your bed right away. It's going to be helpful when you have the baby as well. A waterproof mattress pad is a must during pregnancy. So don't miss out on that one. But in addition to that, I really like these things. Most people call them puppy pads. In the hospital, we call them chucks. They are plastic backed liners that you can put if you're sitting on your couch or your bed or in your car, so that if you were to leak fluid, you just throw that thing away after you're done. There are washable ones out there that you can use as well, but I love the ones that I can just throw away. This is a very busy time in your life. It's okay to take the disposable route at this point. And I'll link one of those puppy pads down below in case you're like, I have no idea what you're talking about, Hillary. Check it down in the description. And again, if you're like, I love tips like this, like the puppy pad, things that can make it easier, that are not expensive. I actually give my very best tips in my birth class, which I'm going to link to down below as well. Okay, the next step is to call your provider. Now, let me give you the lowdown on how a lot of providers do things. A lot of times what you're going to do is you're going to call the office. They're going to have a recording that says we are closed. But at the end of that recording, they would say, if you are having an emergency, then this is the number that you call. Now, sometimes that is a pager. I don't know. I know. A pager. Sometimes that is a call service. So you're going to call that number and they're going to be like, hi. And you're going to say, I think my water has broken. I need to talk with my provider. And they are going to give that message to someone and they will call you back most often. You're not going to speak with someone directly. Although sometimes that is the doctor's cell phone. So they will then pick it up if it is an emergency. Obviously, we only want to use this line if it is an emergency, but in this case, it can be an emergency. You want to talk with your provider, and honestly, they want to talk with you. Gives them a heads up about what's going on with you. You can talk through these things rather than them then having to talk to the nurse about it if you go into the hospital. So it can save them time. You're not being a bother to them. Most providers should have somebody on for them 24/7, 365 days a year. Now, it is likely not going to be your provider. As you can imagine, they need to sleep at some point during the day. But, it might be a nurse practitioner. It might be a labor nurse that you can just talk and go through the things with them. They might have access to your medical records, so then they know if you're GBS positive or something like that. But talking with your provider can be really helpful at this point in time. And as a pro tip, it may take that provider a little bit of time to call you back, which is why if you are having an emergency, just head on into the hospital. Don't wait for them to call you back. But sometimes that provider is on for the whole hospital, so they might be in a delivery or in a C-section, so it may take a little bit of time. Now, here is my challenge for you. At your next appointment, ask your provider what you do if you have something that needs their attention after office hours. So ask them what they should be doing. They should let you know, oh, I have an answering service, or it will go to my pager or my cell phone if you call the emergency line, just so you know. If you've done that and there is an answer, tell me down below in the comments so other people can know what kind of responses you've gotten as well. But do it at your next appointment. It's going to save you a lot of time and energy just so you know what to do in these types of cases. And because it can take a little bit of time, sometimes you want to make this phone call before you jump into the shower. So, it has that time. Just make sure that the phone is nearby and you can answer it, or it's hanging out with your partner so they can answer it and then relay the conversation with you. When you call your provider, that is the time that you want to know about your T.A.C.O.S. You want to know the time, amount, color, and odor of the fluid. They're going to want to talk through those different kinds of things. They also might want to know your history. So it's smart to know if you are GBS positive. They might want to know where you live, or different kinds of things like that, to know how to best help you know if it's time to go in the hospital or if you'd be okay to wait at home. They are also going to want to know if you have any other labor symptoms. And if you're like, Hillary, I have no idea. I thought water breaking and contractions were the only ones. I actually have some early signs of labor. I have a video about it that I will link down below for you as well. Now, during that conversation, your provider is going to say, yep, you should just come on into the hospital. And there might be a reason for that, or that might just be what they say to everybody. Or, hey, you could hang out at home for a little bit. For a long time, we told everybody to come into the hospital if they thought their water has broken. But we know that you can watch for infection just as well as we can watch for infection, but you also get to be at home, comfortable, where you can get some rest and hang out and do things. In fact, I have a whole video of things to do right before you go into the hospital And spoiler alert, sleep is one of those things. So if you could get some rest, it might help your body kick into labor better. So talk with your provider, see what things are going on. But it is okay, even if they say you should come right in. If you're thinking, I don't have any labor signs, I would like to wake it at home for a little bit, you can say, would it be okay if I hung out at home for a little bit? This is totally fine to hang out at home. At that point in time, you're going to be watching for the arch nemesis of a broken bag of fluid, and that is infection, which would be shown by a fever. So you're going to want to make sure that you have a thermometer at home. Every new parent should have a thermometer. In the post that this video is made from, I actually link the puppy pads and a thermometer. I'm going to link that one down below in case you're looking for a thermometer. You don't need anything fancy. Usually these come in around $10 and they take it really quickly. I think it's the best type of thermometer to have with a newborn, so it's handy to have. But you would be taking your temperature every hour to make sure that you're not getting infection. You're also going to be watching for the signs of labor and seeing if those contractions pick up. Again, if they're getting stronger or more painful, are they getting closer together? Are they getting longer? Those are the things you're going to be watching for while you hang out at home. Now, studies have shown that most people will kick into labor within 12 to 48 hours, usually 24 hours if you look across the studies. Usually once that bag of fluid is gone, your body's like, oh, I guess we should kick into labor, right? In fact, most people will actually be into labor very soon after their water breaks, but sometimes your body is just like, no, not in the mood. And so you would need to then head into the hospital to have some Pitocin, because it really isn't great for you or baby to have your fluid broken for a long period of time and just be hanging out at home. At some point in time, your provider is going to say, oh, we should really start some Pitocin, but you can hang out at home for a while. That's totally fine. Again, it depends on like how far away you are from the hospital, your GBS status, all these different types of things. Again, that's why a provider can speak to you and your direct circumstances. And if you're like, Hillary, why is infection suddenly a big issue now? So your bag of fluids has been a closed system, right? Nothing could get in there. You likely even had the mucus plug blocking it all off. If you're interested in more about the mucus plug, I have a video about that. I'll link it down below. But it's been protecting baby from outside bacteria in the birth canal, because as you can imagine, your birth canal is not sterile. And your skin that's around the birth canal. It's been protecting the baby from all of that. But once the bag of waters is broken, all of that can just head right on into your uterus and cause an infection for both you and baby. We call it chorioamnitis, where the area around the baby starts to become infected. We would really try to avoid this. You know, some people can have their bag of waters broken for a long period of time and not get it, but it's something that we need to watch for. And in the hospital, they'll take your temperature every hour, and you can take your temperature every hour at home, as long as you and your provider are both comfortable with it. Now, some of you are going to say, Hillary, if my water is broken, I am done. Put the Pitocin on me. Let's have a baby. And that's okay too. That's why you filled out that birth plan, to know what you would like for your baby. If you want to be in the hospital as much as possible to let things be controlled, that's one type of birth, and that's totally fine. Some people want to stay at home. They want to be in their comfy pajamas, on their puppy pad, on their bed, eating brownies, and that's totally fine too. Doing a birth plan really knows which kind of person you are, so that you can make the best choice for you when the time comes and have that conversation with your provider. Pro tip, if you do decide that staying at home is your best option, please change that pad that you have in your underwear every time you get up to pee, so that you're making sure that that is not a source of infection for you. And also, nothing should be going in the birth canal at that point in time. No objects, body objects, if you know what I'm talking about. And I would keep your fingers out of it. Some of you might be worried that something else came out into the birth canal when your water broke with that big step that I gave you. And so you can use a clean hand to really quickly see if anything is in there. That can reassure you. But beyond that, now we're hands out of the birth canal. And that also includes no tampons to absorb that fluid. I know a lot of people feel pressured when the doctor's like, well, head on into the hospital. They don't feel like they have that option to say, I'd like to stay home. But you can totally do that. Just say, is there a chance I could stay home for a little bit? Would that be okay? So you can start having that conversation with your provider. Honestly, there's so much surrounding birth in the hospital that if people just knew that there were different options and how to verbalize that to your provider in a kind and genuine way, people will be so much happier with their births. And that is what a good birth class is going to help you know what to do. They're going to help you know your different options. They're going to help you know how to verbalize that without becoming a Karen in the hospital. And the birth class that I recommend does just that. I'm going to link it down below. But I want you to know that you have options, and discussing that with your provider is in your best interest. Unless, of course, something else came out in the birth canal, then your best option is to call 911. And sometimes we're forced into options, which I don't love, but that's how Mother Nurture be playing us during pregnancy. I love that you made it this far in the video, and you might be thinking, what am I going to do if my actual water gushes out? I have that whole video on what to do if your water breaks in public. I'm going to link it down below and up above. But thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth. This video is freaking long.